Yes, good morning, sir. Once again, everyone. So today we are going to study how to prescribe a remedy by homeopathic repertory. I'll first tell you what is the repertory, what is the materia medica, and how we can find accurate remedy. See, sometime there is no any shortcut to success. If suppose whatever the combination given by Mata Narayani, in that combination, if that particular remedy is covered by the symptoms, because 90% of the remedy will cover, but there is still, you can't cover 100% with a combination. See, for that reason, we need to concentrate on the remaining people who are not responding to the combination. As narrow we go, as near to the remedy we go, that much we get the good results. Okay. So, law of similars. You know that vibronics and that homeopathy born complementary to each other. So, all the homeopathic remedies can be generated by vibronic machine, or with intention we can create the effect of those things. Okay, now today I am going to talk about how you can individualize. I want to use this repertory. I will tell you what is repertory is. Then we will be able to accurately pinpoint the remedy, and potentially we will talk. Not at all a problem. Okay. So now let me, I already told in the homeopathic background lectures that how homeopathy is proved. They give some medicinal substance to healthy human being, and whatever the healthy human being getting the symptoms, they are listed from the head to toe in a book called as a Materia Medica. This is based on that only our boss called as it is a numerical Materia Medica. But Materia Medica is the remedy, what all the symptom it produces on the healthy human being. Okay, so when it is not done on a single person, hundreds of people were given that remedy and observed what are the symptoms they are facing. Primary symptom and secondary symptom. Primary symptom means immediately after taking that remedy, what you are feeling, what your symptoms are. Then secondary remedies after long effect of the remedies. So both are used as a healing in the homeopathy and the same as in vibronics. Okay. And now repertory is means what? Repertory is okay. Repertory is the symptom versus the remedy. Bonninghausen, the son-in-law of Hahnemann, first framed this repertory. For his own purpose, he made it. So later it came to the light. Okay. So since Bonninghausen was not a doctor, so many people don't consider him, is a worth studying. But it's a fantastic thing. If there are nowadays, you go to the Telegram channel, you will get many books. They are old books, they are in PDF format. You can definitely read, and if possible, like, you can buy one. This repertory is wonderful. I am using this repertory since last 30 years, more than that. So It's a wonderful thing because it is recommended by very highly intellectual homeopath. So, and this I already sent you this this notes on this yesterday. So you can open this, and now I will tell you how this can be used, how to use this. But see, this is most accurate way as compared to the combination. Generally, what you can do is, what we do, we prescribe one bottle, we prescribe the remedies, combination remedies by Mata Narayani. In another bottle, we give this one with a single remedy to take intermittently, or so single remedy works very deep acting. So we have to say only once a day, twice a day based on their emergency. Anyway, in the vibronically prepared remedies doesn't aggravate. It is never aggravated in my hand. And many people given very good feedback that, it's vibronically and intention filled, intention guided remedies never aggravate. Okay. Then we can take any, I will take a, because from my side, I will take and I will try to explain you the how we can go about the use the repertory. I told you the repertory is symptom versus the remedies. Okay, and this book will either in the beginning all the repertories will have the shortcut, that is, what are the coded, what are the homeopathic code, they are written in the either in the beginning of the repertory or in the end of the repertory. I Instead of searching so many other repertory, I recommend this, and I shared this into your uh, WhatsApp. You can use side by side if you want, but we will also take along with that. We will take on the screen share, and I will tell you how to go about. Okay. Now we will take a simple cough. For a cough, what we give generally, cough. If a cough is there, then generally what are the remedy we give? How to see? I told you, volume 3. Keep on checking. Works on, works on, works on. So CC 71, CCA is 71. Chest 200, chest pills, chest tonic, like that. So many things are there. You can go into the index. You can select directly and see how they differ from each other. If you add, there is no problem, but you should not leave. If something is very much tallying to that symptom, you must use it. So that is one way. One way is that, CCA, lung balance, OM respiratory. If you want to add if you think that itis means, I told you, inflammation, infection, you can use the Soham infection along with any of the combination, so that that infection will be reduced. This is one way what Mata Narayan has guided us to use. That way, the one way. Another way is, I'll show you this how we are going about with a repertory. So I'll try to share. Okay, now see, this is the same. This is the same repertory. Now we can even search this repertory also. Let us see cough. Okay. So anyway, it is there in we are only going through the cough. In asthma, cough, so many things are there. If it is associated with asthma, we can think of that. So how to see this? You see the front top portion. So what it is mean? It is covering what? Aversion. This is a chapter of aversion. Okay. So we'll see the cough. We want to see the cough chapter. Coughing. I will see here in the book, and so we can guide there. What will come to know what is the page number? Yes. Page number is page number is 77. Okay. We'll see where is the page number 7. 36 it is. You will tell you beautifully. There are how many, you will be astonished to see how many types of cough are there. How detailed, how minute it is. 77. Yeah, it is all like a dictionary wise. It is arranged in alphabetical order. So, see now CON coming, COUGH is a cough. And I already discussed yesterday, I am going to make you a case taking record sheet so that you will be able to fill that and you will be able to come to the conclusion. Yes, you see, we have arrived at the cough. What are the general remedies for the cough? See, we have to listen very carefully when our patients are talking about their cough. So, general remedies in the cough. How you can do, how generally, in case of lack of time, what I do is, I generally directly operate my pendulum on these remedies. And suppose I get the Brianna is one of the most wonderful remedy frequently used in case of dry cough. So after if I get up the remedy Bryonia, I go back to the Materia Medica, which I already share the app, or even will be PDF is also shared. With that, you will be able to see in detail. Again, what are the symptom of Bryonia? Lot of thirst and moment aggravation. They won't even move. If they move, they get a more cough like that. So you have to tally with the other symptom of the patient. Then we can give this remedy, single remedy, along with CCA, chest tonic, and allergy balance. I told you you have to go through the breakdown, or you can say works on. Based on that, you can decide. And we will also see, because it is a, see, by just reading the book you may get bored. So I am telling you, so we already planned to, otherwise we'll get, if anybody is already having this 7 volume, it's good, or you will have that, and I will tell you where to follow, which number to follow, which page number to follow, then how you can diagnose and how you can decide what remedy to be given. Okay. So you see, so detailed it is. General cough remedies. And if a cough is arising from the abdomen, in the abdomen, from the down to abdomen, if you are getting cough, sometimes it happens. So you can see these are the remedies. And you see, they will tell you, see, carefully you have to note down whatever they are telling. Okay. See, open air aggravation. If open air aggravation, AGG means aggravation. Aggravation means if something is increasing by the open air, that time arsenic, kali nitrate, phosphorus, and rumex. The full form of this you will get in the, I told you, the beginning of the book, where there are all the short forms are in the elaborated form. So open air aggravation, open air amelioration. See, we can see bryonia. How we can do? They will ask you. See, always some question to be asked. If you get I got a cough, then you should say ask whether it is a dry or wet. You get a cough. Then how? When does it aggravate? When is the that is how you feel comfortable by doing anything. You should not say are you having more problem by the moment. No, you should not say that symptom. You say how do you feel better when you have cough. If you do what action you feel better, like that. How do you get relieved? So like that those things are exactly written here. Okay. So we have to general we have to, you already seen, and you see I already told Briannia is written in the capital letters. Briannia is in a capital letter means out of 100 people, if that Briannia is a plant, herb, if it is given to the people, they have developed the dry cough, and the the cough is arising from the epigastrium, or you can say stomach, from down to stomach. If they are like coughing, you can say it is a brainia, and brainia is ameliorated by open air. If they go to the open air, they feel better. So you can say one or more the remedy means symptoms cover that particular remedy. That means you are sure that that is going to help. Okay. So you can say they will tell you everything. No need to get afraid ki how we will come to know. If that particular person will come and tell you, whenever I get angry, I get a cough. In especially children. You see, anger from children. Anger from children, children के वजह से anger नहीं है. And in children, if they get angry, they start coughing. If that is a symptom of anacardium and antimtat, antimtat is a only wonderful remedy for accumulation of cough, tough cough inside the lungs. So how I came to know? Because of reading, going through those remedies, I know. So I came to know. So here it is clearly in case of children, and they are getting after getting angry, that is they are getting a cough. That is these two. Like you see again, arms raising aggravation. Arms raising aggravation or movement aggravation also called. But here homeopathic repertory is very specific. So here they are telling, if I raise my hand, that time I get a cough. So again you see that is a bryonia here. And ferrum phosphoricum or ferrum metallicum and tuberculinum, TUB. So, and you see here, stretching arms aggravation. So how delicate, how minute it is. In this way, if we go and search for the remedy and give that remedy, definitely let it be cause for any reason, they are going to get result. By first moment, first attempt, what you should do? You give the whatever mixture is said in by the Narayan Swami Narayani, we can give that like CCA and allergy balance and chest and lungs. Soham chest and lungs are wonderful formula. And most 95% of the cases we will be able to tackle with the mixture. But we are not interested in that 95%. We are interested in that 5% which are not responding to our combinations. Okay, now we have to do in such a detailed manner, because see, you have acquiring the knowledge has no limit. No one restrict you to have the knowledge. See, ascending stairs. People will tell you, whenever, see, I am fine all the time, but whenever I am ascending the steps, that time I am getting the cough. So then what you have to do? This is argentum nitricum. Again, argentum nitricum, what are the other symptoms? apprehension, we already learnt in previously when we are going through the mentals of the remedies. So argentum nitricum with a mental apprehension and anxiety, and when you up ascending the stairs, they are getting the cough. That is argentum nitricum. Like that, they will tell you how you have to ask. Okay, tell me when does it aggravate? When does it more? The cough you have, how does it get better? How does it increase? I am very quiet all the time. I am very, very comfortable. But whenever I ascend the step, that time I get the cough. Like that, you can see this is a remedy. Auditory canal touching aggravation. Like, some people have the habit of clearing their auditory canal. Like, they make some sound and then they try to clear that eustachian tube is there inside. In there, if they get a cough and accumulation of some mucus, they get a lot of, they make a lot of sound and try to excrete it out. If during that time, if someone is getting, that time is a calicarb, lacasis, and manganum, silicia are the remedy. Barking cough. It is also called as a woofing cough. Boom, boom, boom. You will sound. You see, if possible, I'll find out. I have seen long back. You can hear different remedies cough. So, if possible, we will see so that because learning is an unlimited thing. It may take more than 10 years to learn very detailedly, but good beginning is half done, you say. So we have to say we should know how to approach and get the remedy. Barking cough. Barking cough, you see here, what are the remedies are written in the italics. Italics means slanted way. Drosera and Spongia and Ambragricia. So like that, you have to check this first. Go to our materia medica, try to tally the other symptoms. Like a Drosera is one of the most frequently indicated remedy in case of the barking cough, especially in the children. Children, they go to the school in barking cough is a contagious. It spreads from one child to another child. So in that case, you should definitely remember that Drosera is a remedy, and we can. Yes, you feel it is very difficult to decide in these remedies. I understand that, but you give preference to the remedies which are written in the italics. Go to those remedies, try to find out. And Spongia. Spongia is that is a plant available in the seabed. So spongia, roasted spongia. So that they make a remedy, and they try to spend. I mean, because they all were some or other time they were as a folk remedies. They were all folk remedies. They are taken from the experience of so many people. People were using that in different form. So they took those material and proved in the homeopathy that this is going to help in such and such disease. Okay, in spongia, you see whenever there is a chota jeep होता है ना, आपको देखा होगा. Chota jeep is not epiglottis. The vulva they call. So that when comes and touches your throat, you get a cough. And for that also the spongia is a remedy. So like that, you can go to how I came to know. When you go into there are very big materia medicas, means they will tell about spongia. How this spongia, you can see at the backside blue color set of that book. They are hearings materia medica. Both those are all available now in a PDF format. If you want to go study, want to study in the depth, there are 10 volumes explaining about all these. I think Spongia might have explained in at least 20, 30 pages. But we will not study anything else in that. We are only see the respiratory system, cough, how it is affecting the cough, how it is getting ameliorated, how it is getting better or increasing its intensity. Like that we have to study. In homeopathy, no need to go whole story of that particular remedy. Go to that, check in the respiratory system, whether is it, see, there will be lot many things written there. That reading homeopathic materia medica is also an art. So when you are going to that, you only see whether that particular symptom is mentioned in the list of materia medica or not. If it is not mentioned in that materia medica, choose another materia medica, another person's materia medica, and you see in that if that particular symptom is there or not. If it is telling that particular symptom is written, that's fine. If it is not written, and search for some more accurate remedies. And so barking cough are going to tackle within this remedy. If barking cough with dryness is a clematis. So likewise, we have to go in the, precisely we have to select like a bed. They will tell you, no, you don't get afraid. See, ye kya bhai, bed turning in aggravation. Bed turning in aggravation. It's a creosotum. So when they are turning in the bed, that time they say, whenever I'm keeping quiet, sleeping well, I don't have any problem. And whenever I'm turning in the bed, that time my cough gets aggravation. And that time is a creosotum is a remedy. KRE means creosotum. That we'll get from the first page of the book. And you see, this creosotum is not there in our any of the combination. Like CCA, chest and lungs, respiratory, lungs balance, allergy balance, nowhere the creosotum is written. So if that particular patients need the creosotum and we are not giving the creosotum, that time they are not going to cure. Then we think that no, it is that this system itself is having some problem. Vibronics में ही problem है क्या, I am not able to deal that particular, मतलब उनको ठीक नहीं हो रहा है, हम दे रहा हूँ, I am giving the remedy and are not become all right. That you should think that the right corrected remedy is not there. Okay, so you have to, why we should go in the deep of, like that. And you see, bed warmth, aggravation. So when they are warmth of the bed, when they take the bed cover over them, then they get a, heat of the bed, they start getting cough. And then take out the bed cover, or you can say they go around, then they get relieved. That time again you can say pulsatilla is a remedy. Warmth of the bed is a pulsatilla. Okay, and when they move about, they go around, they if they get a cough, what they do? They go roam around the place, or you can say they feel, if they go outside, they feel better. So you see, the pulsatilla has that property. When they are going out in the open air, they get better. And when the warmth of the bed, it is aggravation. Like that, we can catch this particular symptom in the two ways, and we can come to a conclusion that this is a remedy. Okay, like warmth of the bed, amelioration. Warmth of the bed, amelioration, and you see the argentum nitricum was already there in the ascending the steps. If someone is telling you that I get cough while ascending the step, and when I'm then what you do? They say I go and sleep tightly, with the chaddar ओढ़ के सो जाता हूँ, I'll become warm. So now I get relieved. So you see, you have to ask, by doing what you are getting relieved. So they say warmth of the bed. They say I'm going to bed. And then you have to see which one is the remedy. Okay. Bloody test. Bend forward children. Plus means they bend forward and coughing. Oh, like that they do cough. For them, if they do like that, and there is a lot of phlegm inside, the entim tart, I think entim tart is in many of our combination. So it will cover in the 90% of the people. So I tell you, first thing is never search this book. Never go into this repertory and other thing. First level, give the same thing. CCA, and you say go to the index, you see wherever it is affecting the cough and lungs and respiratory, you add all those things. And there's the same thing. Yesterday we took how we can, if you find a cough, and go back to the CC combos and see what are they have added for the cough, like that. Okay, so with that you will be able to tackle the 90% of the problem. Okay, then bouts. Bout means how many coughs they are making. That also, based on that also, we can say, आपको पूछना है कि हाँ, cough बोले तो, if you coughing, how many times you cough? How many times you cough? Yes, that is, only once they cough, like that, only once they are doing, it is generally covered in the calcarea carb. And two or three means, so you can think about, because see, you already found out many other things. Suppose I will tell you now how to do it. See, already now barking cough with a two or three bout. So barking cough, what are the common remedies we are here? Check. So you have to check the compare between these two. Belladonna. Okay, 3 or 4. So likewise, you see, there are 3 or 4 bouts with the barking cough, then belladonna. Belladonna is the remedy. Likewise, you have to see barking cough, what are the remedies are here. You compare with the bouts. Bout means कितना बार आता है. एक बार कफ आएगा तो one time it will come like that, they continue for 3 or 4, like that you can compare. like general, अभी किसी का और भी एक देखेंगे कि स्टमक से निकल रहा है. it is coming from the stomach. Cough is coming from the stomach, and it is more than 3 to 4 times it is coming. Then see, belladonna is also there, and you see carbobage is not there, and cuprum. Is that cuprum is there? No. So best remedies, the symptoms telling is belladonna. Like when it is 3 or 4 times they are coughing, and it is coming from the epigastrium or from the stomach. So that time, what are the common things in the both the list? So I will tell you, this is a manual work what we are doing, but this is more accurate. The same thing can be done through the what you call our software, but there will be a lot of misguiding there, because you miss a little bit, you go somewhere, because you see, I am able to see all the aggravation and an amelioration here. So okay, then first more violent and but succeeding weaker and weaker. So then first boot like that. First is very loud, and then slowly it is coming. That means it is the entim crude. Entim crude. Likewise, you have to see how he is coughing. Now you have to ask, वो बच्चे को ले हमेशा तो लेके आते हैं, जनरली बच्चा में ही ये सब आता है, बिकॉज ऊफिंग का बूट्स एंड एवरीथिंग, वो उसी की वजह से जास्ती परेशान रहते हैं. दे विल डू इट one big bout and followed by a small weaker and weaker bout, and this antim crude is a remedy. Antim crude is a most it is a most digestive remedy also. Digestion के वजह से हो रहा है, तो you can see here, if that is coming from the epigastrium, in from the stomach, and if it is the first big boat and then small boats succeeded by smaller boats, and tongue is white coated. There are few remedies like that, There, I will tell you how to catch those things. Don't get afraid. It is very easy. I am telling you, you can discuss with me many times. But see, white coated tongue, there are so many other books, they are called as a keynote symptom. With a keynote, we will be able to find out, so which remedy it is. Keynote means, you know that this remedy has one peculiar symptom. So peculiar symptom, with that we'll be able to identify these remedies. Okay, it's very easy, but you need to put effort. Today, you're sowing a seed, definitely it will become a tree later. And the fruits, there they will remain for a long duration. Okay, that's fine. And then we see brain complaint in. If anybody has a brain complaint, having a brain complaint means they will tell you he has got this problem, along with that he has got this coughing. That time GLO, glonine is a remedy. Okay. Breast left coldness with, means what are the condition? Because if some natrum carb is a remedy, natrum carb when is given, many people proved that they were one of their left breast, they felt cold and then had a cough. So in such condition, we can give natram carb. You say what else you have? See, no, that homeopathic doctor and vibronics practitioner should be very, very having a lot of patience. Very delicately, we have to keep on asking what else you have problem. Don't think that this is a separate thing. We treat in the holistic healing. You should tell everything. There is no specialist in our homeopathy system. Yeah, you should tell we are only specialist. We'll be able to analyze everything like that. You should tell. You tell from the head to toe, or you should also ask them to most severe symptom to less severe symptom. There are two ways we can ask. So, okay. Then cannot deep enough, this fantastic thing, when does it happen? Breathing, okay, this is over. Breathing interrupts, you see suffocating. So like that they will write, you can see the suffocating cough. That time, no cough, coughing, now people will get breathless. See, it happens in some children, so our parents will become very panic. Okay, such thing. And see, cannot deep enough. Cough cannot deep enough. This is a fantastic remedy because mostly it is happening in the old age. And even they can't cough even. बाहर का कफ निकाल ही नहीं सकते. They can't take out the cough. उतना उनका they are deteriorated so much like that only. But the chest is full of phlegm. They are not able to cough out. So this is a wonderful remedy. So causticum and rumex, and see that causticum and rumex, there is a inimical chart available. If of course there is one theory says there is nothing like inimical and the complementary. The boric medicas are available plenty in the PDF format. You go and see in that one. I will share with you. The causticum and rumex are a wonderful remedy in the all lungs complaint. Causticum is generally a paralytic remedy. It is used in paralysis. So they don't have enough energy to even cough. So likewise, causticum is given. See, you see how I am going through the all the line by line in the cough. Same likewise, you have to go in any chapter. any chapter of the this book, you have to go line by line, and keep on. You to don't give them hint. Don't give them hint. Is it difficult for you to cough deeply? Don't ask that. You tell you, because they will know. They will be thinking somewhere else, and they say ha. When they say yes, you will be distracted, and you will be given give some other remedy. Not like that. They should come from their own. They should come from their own. Okay. Cardiac heart complaint. With some heart complaints, it's already there. We'll see when it comes. Listen. Causes distant pains. Okay. Beautiful it is, because it are very rare symptoms. And for coughing, they get a pain in the leg. For example, they get a distance pain, means it is a different places. They by coughing, they get a back pain. So such things are there. That time you can go for this capsicum. And change of position aggravation. From the changing of position, cough is more. That time you can give creosotum. And you see, fantastic thing. See, how we have to do is, where all we get similar remedy. Chest. They hold the chest like they do like that. Hold the chest. And you see, along with that, you check other remedies also. Bryonia, Drosera. Drosera is for, again, we saw there in a barking cough. If it is a barking cough, and if they are holding their hand and coughing, and that means it is the Bryonia and Drosera and Repertory natrum self. There are so many other things also, but we have to see, no, go one by one into the deeper the materia medica and decide which one will be most suitable for these people. Wetting emulsion. See, it's a very opposite symptom. What is wetting up a chest? When they say, how they say, don't say that, when I wet my chest, I become all right. They don't say. They say only when I take bath. While taking bath, they wet the chest. So only when I'm taking bath, I am feeling better for some time, they say. So that time you can think of borax, BOR. They're very peculiar symptom. Peculiar symptom. So in peculiar symptom, we'll be seeing that same thing I'm telling you. The borax is not there in any of our combination remedy. So if someone really need borax, let we give any remedy, he is not going to get a relief. So chill before. Okay, cough, chill before. So they get a chill, then after they cough. If such thing, they always give that complaint. They say, I will always get some shivering and chill. Then after that, I get a lot of cough. That means you should think about tuberculinum, sambul, and the rustox. Okay. And you see, chill during, whenever I am getting cold and shivering, that time only I get a cough. And the sooner I get relief from the chill, I am all right. Like that, if they tell, like that, you have to go one by one. See, like that. See, coughing, you will get such a cohesion after having sex. Cohesion is a sexual that action, activity. After that, if they are getting the cough, means that is due to, that is called as a tarantula. And some people, they say that, I have this because they think the healer is my God. I should tell, they say, tell themselves, with the advocate and the one and the healer, they should not hide anything. They say and they'll tell, see, I am facing this is problem. So that time, very peculiar problem. That time tarantula will will address this particular problem. Okay. Then cold. Cold air inspiration, aggravation. Cold drinks aggravation. No, they say I'm thirsty for cold water. I like cold water, but the sooner I take it, I get. Whenever I drink cold water, I get. Like that, they tell. And some people, they say, I am drinking cold water, cold drinks. You see how you have to see here. Cold means, this is a chapter, cold air, cold drinks. Okay. In again, they have the uh, shifted a line here. That means that is aggravation and amelioration and warmth aggravation. Okay. Warmth aggravation. So cold, cold air amelioration and warmth aggravation. See here, I already told you sternum metallicum. You have to think in different way. Sternum metallicum is a mineral. You say, in case of they are architect, I once happened with me like that only. She is an architect. He is suffering from the asthma, and I all with it, and the sternum metallicum symptoms are there. Whenever you talk, more you talk, you get a cough. That is means the paralysis of the vocal cord also it is useful, sternum. So if you use more voice, you are getting cough. It is trained. So likewise, symptoms are there. When I given this, by going through, she's her profession and she's very systematic, very strict, and following step by step. I told you they bring a chit from this day to this date. I was suffering like that. When I was explaining about Rajan Shankaran's method, I told you, and with that, if the warmth aggravation, if it is there, that time sternum metallicum, you can know, just like chess plays, what do you do? A king is been checked from the 2-3 sides. If you put here also is going to be killed. Like that, we have to arrive at one particular remedy from the different angle. Okay. So from, see, this dot is there means it is pertaining to cold. Cold from any cold, they are going to get the sanguinaria and manganum. Milk aggravation. See, cold milk aggravation, that is entim-tart and spongia. Okay. So likewise, water standing in aggravation. Cold water standing in aggravation. So we have to see cold dot is the means it is all connected to the same heading. So you say water standing in aggravation, that is nux moscata, nux yum. So with this, if they will tell you, generally they say when I wash my cloth, then I get a cough. They say you should you should imagine what they are doing in the while washing. Washing is by a washing machine, or you have to ask them. So when I like that, standing in water aggravation nux moscata, and wind in on the chest aggravation. So fantastic it is. See, cold wind, because our children, because it's a general practice. Earlier time we used to travel more by buses and all, and children and even car, they want to see and get the open air breeze. Open breeze, and by they want to sit at the and the window seat. And if they get the cold wind on the chest, if then if that cough is aggravated, or you can say it is not that the cause of the cough is due to cold wind on their chest. Well, chest means they are open, they want to hear face and chest are same only. When you peep outside the window, you are going to get ultimately to the chest also. So the wonderful remedies are phosphorus and Rumex. Okay. Thank you for being on hold. So, on, okay, wind on the chest is okay. Company aggravation. See how mind and they are connected. So mind and body as are connected. In the company, company means not the industrial company. Company means they with along with the people. If they are along with the people, that time it is aggravation. That time you have to think about ambragresia, arsenic, and bretacarb. Okay, and condiments aggravation. So if you take a condiments, anything lavanga and this and that, so spicy things, that time you are aggravation, that alumina. Conscious loss with they cough and then go unconscious. That time that we can cuprum metallicum can be given. And people come with because they will be under somebody's uh, already they are under somebody's guidance and treatment. They will come you for a additional support, so that can you help, how can we help in the spiritual healing. So we can take those people like that. We will be able to help them in this way. Constipation aggravation. If they get a constipation, along with the constipation, or okay, whenever I have a constipation, I am getting a cough. That is conium graphitis and sepia. Whenever there is a constipation, I get a lot of cough. People will tell you, they are very, they do pakka observation. And convulsion with, we already saw, with a convulsion, if it is the, okay, then along with the coryza, you see coryza cries before, coughing aggravation. If coughing aggravation means if they are quiet, nothing will happen to them. Means if they start coughing again, that coughing again triggers that coughing is called as coughing aggravation. They will tell you, once I start coughing, it will continue for long. I feel again and again start coughing. So we have to search within these remedies. And cries before means before they cries before cough, they not before coughing they cry. So crying get the cough. So that we can say like that the causes of so many means this is the main chapter of cough only. Dancing aggravation. Dancing aggravation. When I dance, people will come with you. I put my daughter in a Bharatanatyam, and now whenever she's dancing, she get a cough. So like that, any other dance, Western dance also is fine here. And but this book is written by Indian author. So for that reason, it is in our dancing only. That is not Western dancing. Daytime only. One get the daytime only. So like that, these two are remedy. And deep cough. They cough very deep. So you can think about this remedy. Breathing aggravation and breathing amelioration. They know they breathe very slowly. They say if I breathe deeply, then I am getting the cough more. So like that, they try to control their breathe. So it will happen in such cases because it has created the similar situation. For that reason only they have mentioned it here. And you see descending aggravation. See, there we saw ascending is the argentum nitricum. Here descending the step is a lycopodium. So diarrhea amelioration means if they get a diarrhea, they get a loose motion. then they are feeling better. That time they don't have any cough. So Buforana is a, it's called as क्या बोलते हैं इसको, Buforana is a mendak, frog. This made from the frog poison. And as I told you, all these they might have used as a folk remedies. That is used in our homeopathy, and they have proved this by giving the on a healthy person, and they have mentioned it here. If someone has the diarrhea, his cough get better. That is before. Okay, drinking aggravation. Drinking aggravation. So these are the drinking aggravation and amelioration. If they drink something, if they get if they get something relieved, that time you can say opium and spongia. Then drunkard. Drunkards of, like someone is alcoholics. If someone is alcoholic and they are getting, and you should think about cuckoo's cacti and the stramonium. Cuckoo's cacti symptom is like a, they cough is like a, it is a like a firing. Like for regular intervals, they are coughing. That is cuckoo's cacti. And even while coughing, sometimes the mucus flies off. That is also a cuckoo's cacti. So likewise, and stramonium. Stramonium is for most wonderful remedy for all the insanity, and like that. So including insanity, and they don't want to see the bright light, and like that. When you go into this remedy in detail, you will come to know that how, when this particular thing is used. In case of drunkardness, people are, you have to tally this symptom and try to find out the other symptom with this and give them. Dry without expectoration means cough nahi aata, then phlegm nahi aata. Only dry, total dry without any expectoration. Nothing will come out. In such cases, you have to use uh, these remedies are there, and along with the other symptoms all mentioned in this list, we can think about dry day and night, diarrhea after abrotinum, emaciation with, means someone is going weak and weak and weak, and then no, they don't have any phlegm to cough, and they are only coughing. That time lycopodium. Lycopodium, another symptoms are, you have to tally with other symptoms. Lycopodium main symptom is, if they take a little bit of food, they feel it is enough. Stomach is full, they say. They are most the keynote symptoms. And we can tally with that. If anything is there, and a lycopodium person will be like, tall, slender, they will be, always thinking about calculation, like that, you can think about. Evening, dry cough without expectoration in the evening, aggravation in the evening, that is a pulsatility. Likewise, you have to go one by one, and see, and we'll see when we can uh, decide when, with by using repertory, I will come to this conclusion of remedy. This which remedy is to be given, so we will be able to see. Pinning in children. Okay. What? Dry in the night. This is a common problem. I told you, hyoscyamus is one of the beautiful remedy for elongation of that chota jeep. It comes and touches here in the throat, and you get a coughing. That is a hyoscyamus. And sticta. These are beautiful remedies. And smoking from and speaking aggravation is simisupiga. Spot in the larynx from, particularly from here, they feel that there is a dry cough. omit until. Okay. They cough, and then finally they vomit. So for such thing, Misorium and Sticta are the remedy. Dust feather from dust, and they if they go in the dust and then that is aggravating, that is a remedy. And eating aggravation. You cough when they eat something, that is aggravation. See why I am, it is already there in the book. You can read it yourself. But I am telling you, when we read, it goes into our mind, and in case whenever we are searching it, immediately you can recollect it is here. Okay, fatty food from butter and burger and cheese, and people they take, and at that time if they start develop, that is the pulsatilla. No, pulsatilla has so many other symptoms. Now we have seen the open air amelioration and evening aggravation. Fish aggravation. If someone has, after having fish, they get a cough, that is lacasis. So fruits aggravation. Hastily aggravation. Eating hastily means both fast or gadbad karke, that not with a patience. If they hastily eat, then while they get a cough, that's a sericia. Irritating thing. If something is irritating, like very pungent and very that type of any foods they're taking, like pickles, very strong pickle, and people are in even green chili. They are like to have so many people, but in such irritating things are there. That time alumina, meat aggravation, warm food aggravation. They say no. They say I get aggravated. I get worst when I take a hot food. They make it cold. So they one by one you ask when you get worst, when you get relieved, like that. When you ask them, they will tell you everything. Okay. Then erectation, empty tube as from though. Okay. Then yes, the same cough chapter only is going on. Erectation aggravation, डकार आने से डकार आने से बढ़ना, that is means erectation. When you get erectation, if it is aggravation, this is a remedy. Eruption receding when? Eruption receding when means there is any skin disease, when it is going, in case of measles and chicken pox, this will happen. In case of chicken pox and measles, we get this problem. That time Dalkamara, Lidam Pal, and Pulsatilla are the remedy. And exertion aggravation. So now we see again, heart complaint means you what you have to ask them, is there any other common problem you have, or you have been diagnosed? You have to ask, and they will tell you. Exhausting cough, they go very weak, and they got exhausted, get exhausted. So these are the remedy. So you have to go one by one and follow the habitual cough. So there are some habitual cough also. They keep on coughing without any reason. Flatus passing amelioration. But why I'm telling you is some technical word here, you may not be able to know, but you can find it out. Flatus passing. If you अगर path चला जाएगा तो when you flatus, you leave the, release the flatus, that time amelioration is sanguineria. Fog aggravation. If you're going some people in the fog, aggravation. Futile means there is no useless cough. When a cough comes, but still there is no satisfaction of coughing. So like that. So these are within heart complaint. So fantastic thing. With a heart complaint, these are the remedy. We have a cardiac cough they call. Okay, hollow hot, same hour every day. Then lycopodium and sabadilla. Hot application emulsion. जैसे अगर गरम चीज गर्मी गरम शेक देंगे या के दे they heat that area, they become all right. So this is a remedy. So likewise, jerking lower limbs, laughing aggravation. If someone is laughing, that time it is aggravation. So these are the remedy. Means loose cough. Lot of expectorations are there. Means a lot of phlegm will come. In that time, you can think that is of a loose cough. So you ask them, do you get a phlegm? When you're coughing, do you get a phlegm? That time you say yes, then you can think about this. Lying down aggravation. When that lie down, it is more, that time these are the remedy. It's a common remedy, I told you. Chota jeep बढ़ जाता है तो that like a hyosamus, by going into the dry cough and the lying aggravation, this is a remedy. Likewise, you have to check the king. Checkmate. You have to checkmate the king. Abdomen on amelioration. Lying on abdomen amelioration. Like they want to lie on the abdomen. उल्टा सोना चाहते हैं so that they get some relief in the cough. Measles. Meat aggravation, we already saw. Menses amelioration. Cough, when they get a menses, that is, it is they're getting relief. Menses before amelioration, like that, everything is there. So midnight, milk cold aggravation, morning aggravation, mouth covering amelioration. They cover the mouth. They put they nowadays you get that mask. Then they say, when I put a mask, I am better. So it is you covered including the mouth, so that you can say cuckoo's cacti is the remedy. So nervous cough, night cough, only in the night. Urine spurting with, see, that's when many people they suffer from this. That whenever they cough, their urine leaks out. This is called as a spurting. Spurting urine when they are coughing during the night time. Night and urine spurting with in the colchicum. So noise aggravation. So like that, odor, strong aggravation. Strong odor, they get a cough. See how detailed it is. So likewise, we already saw painful, pregnancy during, early causing abortion, pressure on abdomen amelioration, epigastric amelioration, pressure on like that, lower abdomen. If you put a pressure, that press on the lower abdomen, if they are better. Loudly reading aggravation. So these are the remedy. Response amelioration, retching, gagging, revertebrating, room, entering and leaving during, means change of weather, change of temperature. So phosphorus and Rumax, rub face and eyes with hand during, that children rub the face and the hands, with the hands, they get a cough. So beautiful it is. So means it is so delicate. You will get one or other type of symptoms you get here. Singing aggravation, must sit up. See, like that, must sit up and dry cough. And, if they lie down aggravation, that is also hyosamus. And dry cough, so hyosamus is a remedy. So likewise, we should be given. Swallowing aggravation, sweet things aggravation, talking aggravation, loudly talking aggravation. So, see how beautifully it is tickling. That in the throat, there is a small irritation like that. Trickling and then getting the cough. So, this is how we have to find out. And otherwise, what you have to do is whether is it Is this remedy in this group? Use the pendulum. When you just go, first tally the symptom. After tallying the symptom, operate the pendulum on that group. See, ask whether this remedy to this particular person is in this group, and if not, then go to the next and then check. This is also one of the way we radionic people, or vibronics people, can, or you can say spiritual healer, can use this pendulum and for the deciding the healing remedies. Okay. So woofing cough we already saw, barking cough and woofing cough, and all are almost same. So there are so many. You see the lacrimation with, it's a common thing. When when they coughing start woofing cough, boom 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 like that, they coughing, they get a tears also. They tears roll down. That time you can say natrum mure is a remedy. So like that, yawning and so many things are there. Okay, here that ends the coughing. Okay, up to here it ends the coughing, because it was a very complicated chapter, because we will not have any so many the sub rubrics in that. So now we have understood how we can go about in the repertory. You know, you the same thing can be taken as a eyes. Every, just I given one example. If you want any other subject along with the cough, you can tell me. We will decide, and we will go about how we can diagnose, or you can say how we can the find out the energy remedies, and we can use them in our person when really required. Okay, then I think so. It is all, you may think, whatever it is written there, we are reading it, but it is a must, because cough, how you should also appreciate that how deep it is. Why I get a many complaint that when I am giving this mixture and this mixture, I am not getting the result. That okay, okay, boss. If that remedy is within that group, you will get cure. But is outside those remedies, then that this all Satya Sai people, they have used it, around 576 vibrations only. And so many places they are writing from homeo store and from homeo store. Then how did this it becomes the pure vibronics? We are providing the additional cards for all those they have written in the use from homeo stores, that which is there in our as a code. We can use them and purely practice as a vibronics, the spiritual healing. Okay, thank you so much for being such a boring subject. I believe it, but this was most important. One or other time, this will be useful for you in curing remaining 5 to 10% of the people. Okay, so this is a must, and this is how you will be able to handle the typical cases along with whatever the treatment they are going on. So we'll stop for the day, and we'll see in the afternoon what topic to be given, will decide. And it will be, I already told you, this will be, now we are left with 1 month, because we started on the 8th, we'll be ending on the 8th only. 8th nearby, whatever Sunday, Saturday, we are getting it. So this month only on the how to, and means uh, practical application only will be taught. I'm going to tell you the dowsing parts also. How I used to douse, and there are charts how we can douse, by Bhattacharya method. You first divide into five uh, the different element, like whether it is earth element, fire element, and air, like that. You can uh, we find out first, then for every remedy again, there are so many other remedies are mentioned. That is one way. So we'll handle that also within some period within our frame. Okay. Thank you so much. Uh, really, because you I already shared